Hello friends, welcome to the series of Academy of Carnivals, me and my hysteroscope. Everyone here will agree that hysteroscopy has become part and parcel of our OBGYN practice. And really, it's a wonder instrument. Namaskar. Friends, before starting the session, I would like to dedicate this session to all COVID warriors of the world. We all had a tough time and still you are facing it. Today's topic is guidelines for safety performing office hysteroscopy in COVID-19 environment. Me and my hysteroscope always care for each other and think a lot for sure before entering in the cavity. Is there any risk of infection or viral dissemination? Fear of contamination? How to wear, what to wear, to do or not to do, but believe me, we can plan with proper precaution. Now you must have realized that I wanted to mention COVID-like situations. And for this most needed session, the man behind the machine is Dr. Jose Tony Carungo. So friends, today's faculty is Dr. Jose Tony Carungo. That is Dr. Tony. He is a wonderful friend of mine and very much passionate about hysteroscopy. He is very lovable person and perfect in his work and commitments. I really admire him. He is Associate Professor of Obstetrics and Gynecology from Miami University, USA and works in Minimal Invasive Gynecology Unit. Work with passion and compassion with perfection. Welcome Dr. Jose Tony Carungo in this world of hysteroscope.
Good morning everybody, and thank you Dr. Sushma for inviting me to give this talk. I'm Dr. Jose Tony Carungo from the University of Miami. What I'm going to talk to you about today is guidelines for safety performing office hysteroscopy in our current COVID-19 environment. First, I have to say that I have no financial conflicts to disclose. And as we all know, this terrible pandemic is starting to cover all over the world. It started back in December 2019 actually, but it became global around March 2020, as we all know. And up to date, we still are struggling with this terrible pandemic that actually went all over the world.
Dr. Tony, as you are from Miami, how was the situation there?
And I'm here in Miami, and I want to use this Miami example to describe the struggle that we're having with this COVID-19. And this is back when the heat of COVID hit Miami the most, back in July. We had like the top number of cases just in Florida, almost 15,000 cases per day. And this is our Miami Beach area.
Really, it was worrisome, and today also we have to be very careful. Now tell me, what are the global recommendations for performing hysteroscopic surgery?
But in March 16, all the associations in medicine, at least in OBGYN and women's health, came up with a joint statement regarding elective surgery, and they basically stopped all type of elective surgery. And what they did as a joint statement, also all the societies combined, decided to first of all stop all elective surgery, perform only emergency cases, right? On cases in which delaying the procedure will definitely worsen the patient's outcome. And regarding hysteroscopy, what we're talking today is, patients who were having heavy vaginal bleeding that were not responding to medical treatment, patients with suspected cancer, Patients with cesarean scarectopic pregnancies, retained product of conception that were not responding to medical treatment, and patients with infertility were also considered. That could have been an emergency and they needed to be done.
Dr. Tony, I am very much proud of you and happy to know about your academic contribution with the Global Hysteroscopy Group. Please tell something about it.
And I had the pleasure to lead the group of experts worldwide who wrote the COVID-19 pandemic consensus statement regarding what is the impact of the COVID-19 on hysteroscopy specifically. And we were so honored that the World Health Organization took our manuscript as one of the leading articles regarding women's health.
Well done, Dr. Tony. You mean hysteroscopy is safe in COVID-19 patients?
And as we, were fighting to contain this virus, and people, as I showed, they were just, having fun and basically ignoring all the preventive measures, we wrote this excellent guideline. And this good news. The good news is that hysteroscopy is probably safe, and we should not fear of patients with COVID-19 as long as we take our preventive measures that I'll discuss with you in a second.
But still, I think there is definitely impact of COVID pandemic on hysteroscopy.
Nevertheless, it did have an impact on the amount of cases that were done. And this is an example on a very busy hysteroscopy unit in Naples, Italy. You can see that in 2019, the number of cases of office hysteroscopy just in 2 months were 312, and the same period of time in 2020 were only 68. So that we had a 78% reduction amount of cases of office hysteroscopy and almost a 90% reduction of OR hysteroscopies performed in the same period of time due to the COVID-19. So it has tremendous impact lowering the volume of our surgeries.
Dr. Tony, you also do a lot of surgical procedures. Is there any risk of viral dissemination during hysteroscopy procedures?
So, first of all, we need to understand that the virus is proven transmitted by droplets, right? By air generating procedures. So you have infected people. So with close contact will infect other people. Also, if the infected person touches surfaces and the healthy person touches the same surface, will get the disease, right? And this is the only way has proven transmission of COVID-19, right? By droplets of air generating procedures. What is unknown is COVID-19 transmitted in surgical smoke, blood, or vaginal fluid. And that's what we're going to see in a second.
Now tell me, is the virus present in vaginal fluids of the woman infected with COVID-19 virus?
So far, there is no evidence of COVID-19 virus in vaginal fluid. And this was a study that collected vaginal fluid of a large number of positive patients, and there were not a single virus in any of the vaginal fluid. So we can safely say that there is no COVID-19 in vaginal fluid, as opposed to the GI tract that in feces there has been virus. Well, but not in vaginal, yes, in GI tract.
But in hysteroscopy, sometimes we need to use general anesthesia, elective surgery. Then what is your opinion about it?
Air generating procedure. like intubation or extubation of general anesthesia. The other concern is electrosurgery, right? When we use bipolar or monopolar energy with the resectoscope, can COVID-19 go into the surgical smoke? And this comes because there were studies where we know with other viruses like HPV virus and hepatitis virus and HIV, where there have been particles of the virus in the surgical smoke. But what's interesting to understand that we need to understand the difference between surgical smoke and the hysteroscopy bubbles, two different things, because understand that hysteroscopy takes place underwater, right? There is no fulguration, there is no coagulation. The energy that's applied under the fluid that distends the cavity, it could be, glycine or normal saline, doesn't matter, the principle is the same. What creates is cavities, which is different than bubbles. Those things that we see like bubbles are not really, strictly scientifically speaking, those are not bubbles, those are cavities. And the cavities quickly cool down and it gets dissolved into the liquid. So when these bubbles and these cavities that we're seeing in our monitor are generated by our monopolar or bipolar device, they get suctioned into the outflow channel, and that air doesn't go into the air. So this is what we need to understand, right? So is hysteroscopy itself a aerosol generating procedure? And the answer is no. This is why the electrosurgery is activated, right? It creates these cavities, which is not surgical smoke, as I explained, because the bubbles are produced underwater. So there is no dispersion of virus, right? That even if it's present in the uterus and bloody fluid, there is no dispersion of COVID-19 because it gets suctioned into the outflow channel. So we can safely say that hysteroscopy, it's not an aerosol generating procedure. There's no risk of having COVID-19 viral particles in the air, even when using electroscopy. The key message of this slide is that the outflow channel must be connected to a negative pressure outflow. So based on this, many organizations came to the conclusion that performing hysteroscopy during COVID-19 times is considered safe.
Dr. Tony, what are the general recommendations in this new normal era?
And these are my general recommendations, right? So as a general rule, we have to first, obviously, limit the number of procedures, right? We're gonna favor only those procedures that are potentially dangerous and worsens the patient outcome. So patients with cancer, heavy bleeding, we have to have an adequate screening for potential COVID-19, either by phone triage or by when the patient shows up at the institution outside before letting them in. The temperature must be measured, making sure no one has a fever. We must restrict the access of companions, right? There's no children coming without patients, and obviously no elderly people, considered elderly family members of companions of 60 years of age or older. This is mostly to protect them, not to protect the patient. We need to ensure there is appropriate social distancing at all times, even in the waiting room. Chairs must be placed the minimum of 6 feet apart. Everybody should wear adequate PPE, and I'll go over that in more detail in a second, but both patients and the staff must wear appropriate PPE. And unfortunately, we need to limit the presence of team members. There is no place for learners at this time. We're gonna have only essential personnel in the room.
Perfect. But a precaution should be taken during procedure.
during the procedure. So regarding PPE, right? So the patient must wear a mask. At all times, everybody wears masks. The staff must wear a mask, ideally N95 if the patient is known to have been COVID positive, but it could be any other mask, and should wear also a shield to protect from spilling. As I said, we need to limit the number of individuals that are present in the room. Unfortunately, something that we love to have, we love to have a lot of nurses in the room. This is not the time for it. We need to avoid elective surgery. As I already explained, those are safe, but if we could avoid them and favor mechanical instruments like the tissue retrieval system, that will be ideal. Well, as I said, at all times, we must connect the outflow to a closed system with a negative suction system. And we need to avoid, multiple insertion and removal of the hysteroscope inside the uterus. Well, this is basically an advice that we should do on any hysteroscopic procedure, but moreover in patients with suspected or proven positive.
Okay, procedure is over. But what is next after the procedure?
After we concluded with the procedure, we need to allow the patients to recover in the same procedure. This because now the patients are staying in the room. We need to allow enough time in between patients when we schedule the patient for the hysteroscopies. We are expediting the discharge. When now the follow-up are done by phone or telemedicine, limiting the numbers of visits as least as possible. And this is the most important thing. Both standard endoscope disinfection is effective. We should not modify the way we clean either the endoscope, and the standard suite and equipment disinfection is effective. So I want to stress this. Even when we're using our equipment in confirmed COVID-19 positive patients, the way and the products that we use to clean both our hysteroscope and our instruments and the suite itself must be the same. It's not like, when HIV that we used to chloride or other products to kill the virus. With COVID-19, we could use the same standard disinfection technique. No need to change. And this is important that everybody understand that.
Dr. Tony, you have explained everything in detail. Now I would like to ask one question regarding pain management during hysteroscopy. You have written a wonderful chapter on pain management in my hysteroscopy book. But we would like to listen from you.
Hysteroscopies are performed without no anesthesia, no need for anesthesia, as long as we adopt the vaginoscopy entry technique. So diagnostic hysteroscopy, no anesthesia. Small operative hysteroscopy might consider Toradol, ANSEF, or a paracervical block. And if the procedure is long or the pathology is extensive, the enough hysteroscopy is aborted and the patient goes to the operating room and the hysteroscopy is performed under general anesthesia.
Tons of thanks, Dr. Tony, for nice information. Now please summarize all the precautions when you are in operating room.
And that when we are in the operating room, right, let's just say we're taking the patient to the operating room, and in COVID-19 times, everybody gets a PCR testing for COVID before going to the operating room. And this is done regardless of specialty, regardless of the procedure you're getting. If you go to the OR, you need a PCR testing within 48 hours. That's hospital rules. For anesthesia, we favor local and regional anesthesia over intubation, just to avoid the aerosol generating procedure, which is intubation and extubation. If general anesthesia is going to be given, this patient is going to be intubated, well, then the entire staff stays outside the room until the patient is fully intubated. one important thing, if you're operating on COVID-19 patients, staff should not go in and out of the room like in a regular case. The assistants and everybody that should be in the room and not leaving the room until the case is concluded. We should choose a device that allows an effective, a fast procedure. Remember, there's no learners in the room. You have to do this quick. We're going to favor non-cavity or bubble-generated devices like tissue morcellation system over the resectoscope. And remember that the suction must be always connected and an outflow in a closed system, as we already discussed. And this is an algorithm that is in our manuscript that help us to navigate how to decide the environment in which we are going to perform the hysteroscopy in patients with COVID-19. And so you are welcome to download our paper or see this algorithm that would allow us to decide how to proceed regarding the surgical environment in times of COVID-19.
And lastly, what is your message to hysto lovers?
Hello, dear hysto lovers. It's a great pleasure for me to say hi to all of you from here, from Miami, United States of America. I want to thank Dr. Sushma for inviting me to give this brief talk and having this very nice conversation with you. I know this is very difficult times, but we all will get through, and hopefully we will meet in person. I will share more knowledge and all those tips and tricks that we love to share about hysteroscopy. So keep it strong, keep the strong work, and I'll see you soon in the next meeting, hopefully in person. Take care.
And this concludes my presentation. Dr. Sushma, thank you so much. Once again, it's for me a great honor to participate in your symposium. That's my email. If you feel free, please send me an email, any questions and comments that you have regarding this talk. Or if you ever here in Miami, I'll be more than happy to host you here in South Florida to have a nice vacation. Thank you so much one more time, and hope you all stay safe. Bye-bye.
So friends, here we end our discussion. Now we all have realized that hysteroscopy can be done in COVID pandemic also. And hysteroscope is such a precious ornament that we should have it in our instrument list, and we can use it in our OBGYN practice regularly. Thank you.